Hello and thanks for watching this video series on engaging primary care in opioid process improvement. This video will provide you with some background information on the history of opioid prescribing.
As you know, Alberta and the rest of Canada and beyond are in the midst of an opioid crisis. According to the College of Physicians and Surgeons of Alberta, Canada has the second highest prescription opioid use per capita, and Alberta has the second highest consumption of all provinces.
Opioids have been used for pain management for thousands of years. In the 17th and 18th centuries, physicians used laudanum, which was a combination of alcohol and opium, as a common remedy. In the 1800s, morphine was isolated from opium, and it became a preferred treatment for pain, anxiety, and many other ailments. In the 19th century, a morphine alcohol syrup called A Mother's Kiss, Mrs. Winslow's Soothing Syrup, was marketed for helping children to sleep. Synthetic opioids, like oxycodone, were introduced in the 1950s. Doctors quickly embraced them as a treatment for pain. During the 1980s, physicians explored the use of prescription opioids to treat cases of chronic pain. The prescription opioid landscape changed again in the 1990s as new slow-release opioids entered the market, offering pain treatment options that were supposed to be safer. In the 1990s, aggressive marketing of drugs like OxyContin encouraged physicians to manage patients' pain by liberally prescribing opioids, which physicians were told were safe and non-addictive. Now we know differently, and we're once again asking physicians to change their prescribing behavior.
We want to be clear that although prescription opioid use has become problematic, stopping prescribing of opioids completely is not the solution. Opioids are powerful drugs that still have their place in pain management. Primary care just needs some processes around ensuring their safe and appropriate use.
Well, thank you for watching this first video, and be sure to check out the next two videos in the series, starting with The Face of the Opioid Crisis.